So here's what I wish I had done is because his range of motion was so good, I don't know why. Normally I would go in and do a little overpressure right there to get them to end range. So what I missed seeing on day one is, and I don't know if it would have been there or not, but his loss of external rotation, it would have been nice to have a passive test, because if it was full passively, then there's less likely to be a derangement in the shoulder, maybe contractile would be it. But if it was obstructed in external rotation, even passively, then I might have thought, oh, I got to clear a derangement first in the shoulder. So that step of clear the spine, now you're in the shoulder, make sure there's not a derangement there. So that contractile dysfunction is you have to exclude some other things, because contractile dysfunctions can mimic other things. And definitely they can mimic a derangement. So as he was demonstrating his lost external rotation, I had him relax and took him passively, and it was obstructed. I couldn't get him there even passively. I thought, didn't do the steps I normally do because I had an audience and I'm trying to engage another therapist, and missed that subtle, which is really PT 101, that's new grad, right? Active range, passive range, resisted range. And I missed the passive external rotation because it was a minor loss, and it was weak and painful on resistance. So what also confirms your initial classification is your prognosis, because we know the loading protocol for a tendon problem or contractile dysfunction takes a while. Like, they don't get better in 3 or 4 days. Well, this guy was pain-free by the 3rd visit once we got this right. So all we had to do was get his elbow on the table. So I did external rotation that way, elbows on the table, use his other hand. And it was obstructed, produced no worse, but more and more range of motion as he did it. And then we grabbed that 5-pound weight in scapation, and it didn't hurt. We had to go to an 8-pound weight before it hurt. And when he saw that, I talked about not to stop his workouts, but to sandwich, make sure he gets that external rotation as far as he can, do his workout, and then come back after. If he's sore during his workout, to pause and check that external rotation. Is there something in your workout that's undoing the good that the external rotation does? And he was rapidly able over the next couple of weeks to get back to a full workout. He did need the next visit some reassurance about really going into overpressure. So I missed a derangement in his shoulder that first day as well. And that was a fun one, thankfully, because he got better so fast once we were right on track again.